Viruses need to survive, and they want to live inside of a host, which is usually a human. Sometimes it's a bird, sometimes it's a pig, And germs are sometimes smarter and better at evolution than we are. They can evolve much quicker than humans can. And so they're going to find a host that's susceptible. When we say susceptible, that's someone who doesn't have protection, like from a vaccine or a prior infection.
The way I describe what vaccination is it's like a seatbelt. We put on seatbelts in our car because in the rare occurrence that we do get into an accident, we know that we are already protected. And vaccines are the same way. Vaccines prevent us from getting really sick in the rare occurrence that the virus or bacteria does enter into our system. At least then we know that we're protected.
A child with influenza, a child with whooping cough, a child with measles is an incredibly stressful situation on the family, physically, emotionally, financially. Some people can't afford to be out of work for a week while they nurse their child back to health. And to think that all that could be prevented with one vaccine is incredible.
Vaccines are the reason that we don't see measles, smallpox, polio in our communities anymore. It's very understandable that people would have questions about why are we still getting vaccinated? We don't see these diseases anymore. But if vaccination rates drop, we can start to see those things come back.
And I've even had parents say, well, if this is your child, would you give them this vaccine? And my answer to them every time is, well, my daughter's already had this vaccine.
We need to appreciate where we are, where we've come, and that we don't want to go backwards. Not in this day and era. Like, we've made so much progress, and unfortunately, if we don't keep vaccinating effectively, we're going to go backwards.
When you get vaccinated, you should feel good. You protected your family, friends, colleagues, and then your neighbor, and it grows.
I think as an individual, it's incredibly important to think about how we impact our world and how we impact our community. And vaccination is one way in which we can really make a positive impact into our community.
Doctors will always talk to you about eating a healthy diet and exercising, but they don't talk about how to be strong and resilient. And vaccines are also an adjunct to that because they make you strong, they help prevent illness, and they let you go out and be the best that you can be.
Not only have I protected myself, but I'm able to protect the people I interact with. I'm as well protected as I can be, so that way I can help serve my patients as well as my family.
At the heart of a human race, that's our goal in life, is to spread good and to take care of each other and help each other.
Ask your questions, clear your doubts, and then make an informed decision of what is safe and what is important to keep your child healthy.
Vaccine education and awareness is the number one priority for children to help protect them and to help protect their communities. Having an awareness and an acceptance of the benefit of vaccines is immensely important to the future health of our children.